Welcome everyone. It is 2:15, so we're going to go ahead and get started. So welcome to the equity session of the PA-AV Summit. My name is Jennifer Warner Hayman, and I am the moderator for today's event. So I work as a traffic engineer with Michael Baker International in the Harrisburg, Pennsylvania area. And I'd like to thank you all for taking time today to listen to our fantastic lineup of speakers in this session. So a few housekeeping items before we begin. Just so you're all aware, this session will be recorded and will be available for attendees later this year. You will also see that your microphone has been automatically muted to reduce background noise. Please feel free to use the chat function on the right-hand side of your screen for general conversations and comments, and the Q&A section of the platform to ask questions about the presentations, and you can vote on different questions and upvote them to try to get them to be answered. Right? The higher the votes, the more likely they'll get answered. There will also be a panel discussion following the speakers' presentations. I will be pulling questions from the Q&A section, so if you have any questions posted in the chat, we may miss them, so make sure you really get those in the Q&A section. All right, everyone. Our first presenter today is Kathy Cameron with the National Council on Aging. She is the Senior Director of the Center for Healthy Aging. Full bios are available on the website, but for now, I will hand it off to Kathy. Take it away, Kathy.
Well, good afternoon, everyone, and thank you so much, Jennifer. I really appreciate the opportunity to be part of the session on equity. As Jennifer mentioned, I'm with the National Council on Aging, or NCOA. We're located right outside of Washington, D.C. in Arlington, Virginia. And we are the oldest national nonprofit organization dedicated to improving the lives of older adults. And my particular background actually is in pharmacy, public health, and gerontology. And I've been with NCOA for about 7 years. And I've worked in the field of aging in various capacities for over 25 years, specifically on efforts to improve the health and quality of life of older persons. Next slide. I thought I'd start with a little bit of background on why aging well matters and what we know about older adults. First of all, by 2030, the number of older adults, and I define that as those over the age of 65, will reach 93 million, or about 20% of the population. And it's important to recognize, too, that the older adult population is becoming more and more diverse as communities of color age. But we do not all age equally, and there are, systemic disparities, inequities, including access to transportation, that make it impossible for every person to age well. And how a person ages, really varies greatly in where they live, the color of their skin, their gender, and their sexuality. We know that nearly 80% of older adults experience at least one chronic condition like diabetes, heart disease, arthritis, that significantly impacts their daily life, and that includes their ability to continue to drive. We know that about 80% of older adults are financially insecure today, or they're at risk, and 10% live below the poverty level, which of course can also limit their access to transportation options. We know that Black and Latinx adults are twice as likely to live in poverty than older adults who are white. And at NCOA, we believe aging well is something that every person deserves. Next slide. We work in 4 areas. One is the development of resources, trusted, unbiased information that enables older adults and their caregivers to take steps that can have a big impact on their health and quality of life. We also develop tools which are personalized online support for individuals to find benefits, and that's like we have a benefits checkup. We have tools to help people make choices around Medicare, help them prevent falls, which is the most common cause of injury among older adults, and really help them plan for a healthy and secure future. We also disseminate best practices to the field, and we specifically work very closely with community-based organizations who serve older adults every day. and we lead the National Institute of Senior Centers. So for many community-based organizations, transportation is a key part of what they need and what they deliver to older adults. We also have a very active advocacy department. We work to fight against ageism and strengthen federal programs that we depend upon as we age, like Medicare, Medicaid, the Older Americans Act. Next slide. NCOA, we have an equity promise, and really equity is the foundation for the work that we do. And this slide describes the values that are the underpinnings of our work. In regards to health, we recognize that access to affordable health care for all Americans includes not only healthcare services that are provided in doctor's office, hospitals, clinics, pharmacies, and other healthcare settings, but also access to what are known as the social determinants of health, which are the conditions in the environment where people are born, live, learn, work, play, worship. And that age really impacts a wide range of health functioning and quality of life outcomes. All of these things really play a role in health for older adults. So these social determinants of health include, of course, transportation, but also safe housing and safe neighborhoods, education, job opportunities, and income. And certainly, I believe technology is one of the social determinants of health. We recognize that that's an important part of staying healthy, particularly during this pandemic. So our work really encompasses access of important social determinant of health benefits and programs, including transportation. Next slide. So a couple of facts and what we know about the transportation reality for older adults. In 2018, there were more than 45 million licensed drivers aged 65 and older in the United States. And that was actually an increase of 60% since 2000. We know that older adults outlive their decision to drive by about 10 years for women and 7 years for men. And it's not just oftentimes their decision, it's someone else is making the decision for them that they can no longer drive. We know, so that the 7 or 10 years is really a significant amount of time for older adults to have to rely on others for their transportation needs when they can no longer drive. And why do they have to stop driving? Not surprisingly, it's the chronic conditions that I mentioned, like arthritis, Parkinson's disease, stroke, Alzheimer's disease, also medications. This is an area that I've been working on, looking at which medications impact driving. We know there are many medications that cause side effects that can slow reaction time, impact coordination, make people sleepy at the wheel, lower alertness, and can create difficulties in concentrating. So, the inability to drive really impacts an older adult's sense of independence, being in control. That's what's lost when driving ends. And this can lead to social isolation. We certainly saw that through the pandemic. And with older adults having, comparatively, fewer transportation options than younger adults, AV is often viewed as one technology that can extend an older person's ability to remain independent as long as possible. So I want to very quickly share with you, next slide, some results of a small survey that we did. It was an online survey with support from Volkswagen Group of America, and we surveyed older adults through an online platform to better understand what their attitudes were about driving. It was a 31 item survey that looked at their current transportation use, some health and sociodemographic variables, perceptions and attitudes about alternative transportation, and also looking at self-driving and ride-hailing options. And I'm going to present a little bit on what we learned from this survey. Next slide, please. So we had about 2,500 people respond to this survey. They tended to skew younger, about 60 years old. 64% were male who responded, predominantly Caucasian population who responded, but about 15% of the respondents were African American, 4% Native American. It tended to skew a little bit higher income as well. 40% reported income between $3,000 and $4,000 per month. Many were in good health, but some rated their health as fair or poor. And some had, about 44% had at least a college degree. We learned through this survey, most of the people owned or leased their own vehicle. They were current drivers, and many used other forms of transportation, but that also included driving with a family member or friend. And most of them, almost 70%, agreed or strongly agreed that they were satisfied with the alternative transportation options available in their area. So if we can go to the next slide. In terms of what we learned about their attitudes about self-driving vehicles, we found, it was pretty positive, that they would, about 72% said that they would increase their ability, that SDRH would increase their ability to achieve tasks outside the home, that they would trust such a vehicle, that they felt confident, that it would enhance their safety as they got older, and agreed that it would enable them to remain as independent as possible, and that they expected to use self-driving vehicles in the future. Next slide. And the most important aspects of self-driving ride-hailing services that they thought, again, were safety, that it could enhance their safety as they got older. They felt the quality of the service would be good, convenience, that they could get where they wanted to go, when they wanted to go, that it would help them navigate through traffic. The least important aspects were things like, they didn't care about luxurious interior or the style of the vehicle. So their greatest concerns, of course, were safety, privacy, and use of their personal data was really important. And then, again, convenience. So next slide. We took a little bit of a deeper dive too, and we wanted to know more about kind of subpopulations that were surveyed. And one of the things that we found is that those who were older had more difficulties with walking, dressing, doing errands, hearing and seeing, and lived more in rural areas. They had poorer perceptions and attitudes around alternative transportation and self-driving ride-hailing services, and a lower intention to use those services. So these are the more kind of difficult to serve older adults, because of their needs. So, some of the challenges of working with them, focus on their access to technology, their ability to enter and exit an AV, and then also how they can access the vehicle, because many are curb to curb and not door to door, which is what many older adults need who have limitations. So I'm going to end it there, and we're going to have time for Q&A at the end. But thank you so much.
Thank you so much, Kathy. Really appreciate it. Audience, please remember to post any questions you may have for Kathy in the Q&A portion of the platform. We will make sure to address those during the Q&A portion of our event. So thank you again, Kathy. Our next presenter is Adam Schell, who is the Automated Transportation Program Manager for Iowa DOT. Adam, take it away.
Thank you, Jennifer. Take it you can hear me. Just a quick mic check.
We can hear you. You're good.
All right. Thank you. All right. Let me get set up here just real quick. Okay. So, yeah, my name's Adam Schell. I'm the Automated Transportation Program Manager at the Iowa DOT, lead a variety of initiatives and efforts related to our program here. New position for the department. I'll get into that here a little bit more. Been doing it for about 3 years, though, but at the department for 15 years. I'm excited to be representing Iowa here at the summit. Do kind of want to just maybe provide a little bit different perspective on what we're doing as a state, as an infrastructure owner operator or Department of Transportation to to pursue and support activities related to automated transportation. As I mentioned, presentation will focus on some of the work we're doing. As you can see on the slide here, some of the areas that I'll hit today. Nationally, there are certainly differing approaches and perspectives by state DOTs to support automated transportation, and I would tend to fit in the category where we're early in the journey and still getting organized, trying to figure out where we kind of fit in the grand scheme of things here. But generally, our focus areas have been on emphasizing some of the enabling policy as a state, data-related initiatives through our research partners at Iowa State University and University of Iowa. Certainly items I'll dive into here more throughout my presentation. So as a state, we are fairly rural. A lot of times we're confused with other states like Ohio or Idaho. But anyway, we're rural in nature, 3 million people, number 1 or number 2 producer in the world of corn, bean, hogs, and eggs. Number 1 producer of biofuels. So we have a lot of travel coming through. A lot of ag commodities, obviously. So we're a heavy export state, 20,000 trucking companies in the state. A lot of travel, a lot of roads, a lot of infrastructure to take care of. So to kind of give a baseline here, I'd like to kick things off with how we, define automated transportation. A lot of these elements my state DOT peers will see that are similar, but we like to highlight the cooperative nature of it, the possibilities, if you will. Certainly, some key aspects of automated transportation are the multimodal system. My focus is definitely on the connected automated vehicles, but other state partners are certainly focusing on air mobility and things like that. Infrastructures are critical. A lot of people think when they think of infrastructure, they only think of the physical, roads, bridges, but obviously there's the digital infrastructure, the data, the communication means to connect vehicles to one another or, say, a traffic management center. And then lastly, the institutional system, the enabling policies, supporting services that are required to allow for this type of emerging technologies to be enabled. So real quick, I do want to touch on some of the organizational readiness areas. As an agency, obviously myself, as a CAV or Automated Transportation Program Manager, I dedicate 100% of my time to this work. We are looking to expand additional staff time with a new position actually in our motor vehicle division. We're one of those states that has those operations within our DOT. We don't have a separate DMV. So that person will, once it's filled, will focus on things like mobile ID or driver's license, but also have some of the work tied to registering and titling automated driving systems. And I won't go through all the detail of all the coordination engagement we're doing with groups internally or with our partners, but we're obviously working to coordinate and align on this topic. We don't have a dedicated task force internally like some of our other state peers do, but we're certainly working to engage on this topic as an agency. So when it comes to stakeholder engagement, the Iowa Advisory Council on Automated Transportation is the, or ATC as we refer to it, is the primary stakeholder group. Provides guidance, recommendations, and strategic oversight of automated transportation activities in the state. Was created in 2018 and now meets up to 3 times annually. This group is chaired by our director, Scott Marler at the Iowa DOT. As you can see from the list, we have many agencies involved. We don't have a lot of our, or a few of our private sector partners identified, but we do have some industry engaged with this group as well. So one of the key areas that we've been focusing on as a state is some of the visioning and planning work. The Iowa Advisory Council on Automated Transportation did develop an AT vision document in March of 2020, sets the roadmap for the safe advancement of automated transportation. Roughly 24 tactics or activities were developed for the ATC to pursue. We're also working to update our state long-range plan, working to identify a no-hype summary, right-sizing policy to help identify, how do emerging technologies fit into our project development process and program. And then lastly, internally, we developed a cooperative automated transportation service layer plan, which is a tactical plan specific to the department to help identify, what we need to do going forward. One might ask, well, what's the difference between your statewide vision and your CAP plan? And the CAP plan, again, more specific to our agency and doesn't touch on things like economic development, insurance, and things of that nature. So it's certainly more specific to us as an agency. I do want to quickly touch on some of the policy and legislation that we've been pursuing as a state. The Automated Driving Systems, or ADS Framework Bill, was introduced and signed into law in 2019. It's a first for our state. Allows for the operation of driverless capable vehicles in Iowa on public roadways. It is based on model legislation. Does include both passenger and commercial motor vehicles. So this was a pretty pivotal bill for us. It did provide us broad rulemaking authority amongst other notable sections, such as new definitions, operation parameters, or broad operation requirements, crash reporting, and things of that nature. When it came to the broad rulemaking authority, we have been working on that and developing administrative rules. That process is actually just wrapped up within the last couple months and did take effect this month. One notable change throughout that process is we were looking to identify a permitting process, but we switched to an exemption process, looking to identify automated driving systems in the registration and titling process. Another notable bill was our falling distance bill, which did remove falling distance requirements for vehicles falling closely. So those distance requirements are no longer required or in state statute. What this bill essentially does is, coupled with the ADS framework bill, essentially allows for things like truck platooning and things of that nature to occur where vehicles can follow more closely. Just removed a barrier, if you will. And then lastly, personal delivery devices, or PDDs, is also those smaller, cooler sized devices with wheels to support the last 50 feet of delivery. That legislation did pass in Iowa. Interestingly enough, similar to various legislation in other states, but it does include some notable difference given we have our ADS framework bill. Because they're not vehicles, they're not subject to registration and titling, and does require a little bit higher insurance premium compared to some other states. So to kind of get to the meat of what I wanted to emphasize here with where we're going as a state, or some of the challenges and opportunities to kind of tie it back to the session here tied to equity. As I kind of briefly indicated, we're a rural state in Iowa. So, when it comes to the urban versus rural nature of Iowa, we're obviously, as you can see in the demographic section there, we're, a lot of folks live in urban areas. So when it comes to roadway safety, certainly a lot of disparity, if you will, when it comes to crashes. We have certainly a significantly higher proportion of fatalities in our rural areas. When it comes to our transportation system, it's certainly aging. Infrastructure is getting, older. And when it comes to deploying some of these emerging technologies, especially depending on the use case, in urban areas, for example, I mentioned those personal delivery devices or other technologies in urban areas. The concern is will there be an equitable opportunity to take advantage of those devices? And that's often a question communicated by stakeholders in our state. So I mentioned the demographics. Obviously, we're having slow growth. We're getting older. Certainly becoming more urbanized and anticipated to become more diverse. So trying to navigate how we can address some of the potential equity and accessibility gaps by partnering with industry and other public agencies to ensure some sort of uniformity across the nation. And then lastly, limited rural AV research is something that's certainly been identified with some of our partners at the University of Iowa, which I'll get into here briefly in a moment. So as a state, we're certainly trying to pursue strategies, infrastructure enhancements, if you will, that support advanced driver assistance systems of today and automated driving systems of tomorrow. I know that's not always possible, but we're trying to take certainly a more conservative approach to our investment with infrastructure, make those wise investments. So some of the things we've been pursuing with our partners at Iowa State University are noted here in the slide. And given I don't have a whole lot of time here, I'll make it brief, but we're certainly working on some of the work zone data side of things, integrating connected smart aeroboard technology. Winter weather or broader weather reporting is certainly a significant opportunity. We have a lot of flooding in Iowa, obviously a cold weather state, so we have to deal with snow. Working to automate some of the audible warning systems on our crash attenuator vehicles for our slow-moving maintenance operations. And then much like other states, looking to expand some of our pavement markings and make them wider, brighter, and easier to see. And lastly, I think the summit here has been held before and heard from our partners at the University of Iowa, but one of the things they are working on is pursuing as part of a federal grant from the USDOT to outfit this transit vehicle here, shuttle, if you will, paratransit shuttle, to address some of the goals that have been noted here. Again, trying to enhance mobility, represent rural roads and ADS testing that's been underserved, if you will. So they've actually begun testing. They have a handful, several phases they're working to do, and they have done a few runs within the first phase and are collecting data and have been able to automate up to 50% of the time on the route that they're serving. So seeing some positive results already. So with that, I will yield the mic to the next presenter.
Thanks so much, Adam. Greatly appreciate it. All right, everyone, friendly reminder once again, if you have any questions for Adam, make sure and add those into the Q&A portion of the platform, and we'll get to those during the Q&A portion of this session. Our next speaker is Richard Ezike, and he is the Director of Infrastructure and Engagement for CHPlanning Limited. Richard, take it away.
Thank you, Jennifer. And it's an honor to be here to talk about at this conference once again. I spoke at the last one we had in person, I believe, in 2019. So I just want to thank the Pennsylvania Department of Transportation. I want to thank Roger Cohen for inviting me back. And I look forward to talking a little bit about this important topic of how automation can help improve equity in our transportation system. And so I'll do a short presentation about some work that I did at the Union Concerned Scientist, and this title's presentation will be called "Where Are Self-Driving Cars Taking Us? Pivotal Choices That Will Shape DC's Transportation Future." So a little bit about me. As I mentioned, I am the Director of Infrastructure and Engagement at CHPlanning, which is a small urban planning firm based in Philadelphia. That does a lot of work with local jurisdictions and neighborhoods. And my work there was focused on really building out our practice here in DC, more focused on infrastructure projects and community engagement. My background is in chemical engineering, so I'm kind of a transplant into transportation. I've been in the field for the last 7 years, and a lot of my focus has been around this idea of equity, accessibility, and how we can improve our transportation systems for our communities. So, and then the last couple of years, I've been involved in the AV space and thinking about how this new technology could help improve equity and accessibility and potentially fix historical trends that have made our system inequitable. But at the same time, also being aware that without strong policy guidance, this technology can also even exacerbate the inequities and the gaps in our transportation system that we already have. So I'll talk a little bit about the work that I did when I was at the Union Concerned Scientist, which I did a fellowship in 2019, and really focusing on this topic of equity and accessibility and how AVs can help or hurt improve that. So move on to my presentation. Okay, great. So as I mentioned, this work is based off of a report that we published as the Union Concerned Scientist fellow that we published in February 2019 called "Where Are Self-Driving Cars Taking Us? Pivotal Choices That Will Shape DC Transportation Future." And I'll go a little bit in my presentation about how we did the work and what we were looking at and what are some of the recommendations in terms of policies that we developed to help promote AVs in a way that can, again, promote equity and accessibility. So I think it's always important to start a question about, provide a question about what it means to have an inclusive transportation system. That's the basis of what we're trying to do here. Is we want to make sure our transportation is inclusive for everybody. So no matter where you live, no matter what your environment is, what you look like, you can have access to clean, affordable, equitable, and cost-effective transportation. And so I think there are 5 key components that define what inclusive transportation system looks like. First it must be accessible. There should not be an undue burden of access for transportation, especially for people of color, people with disabilities, and senior citizens. It should be very easy for people in any neighborhood to access grocery stores, hospitals, schools, and other amenities of importance. It also must be multimodal. People should be able to get to where they want to go using multiple options, whether that's the car, public transit, walking, scooters, bikes, and other modes that are available to us. Third, it also must be affordable. Right now, transportation is currently the second largest expense in American household behind housing costs. And these costs make it difficult for those with limited means to get around in the area where they live. No matter what mode is available, it must be affordable for people to get around. Next, transportation must be equitable. And unfortunately, many of the benefits and harms for our transportation system are distributed unevenly. Some neighborhoods have more transportation options that make it easier for people to get to where they want to go, while others tend to see fewer options, and that results sometimes in lower quality transit, longer travel times, and more the negative effects of transportation from the congestion or air pollution. And unfortunately, this latter group tends to be made up primarily of low-income members from low-income communities and communities of color. And lastly, it must be low emission, particularly matter that causes life-threatening health problems, tailpipes emissions that contribute to the climate crisis, traffic jams that keep on cars that keep idling and affect the quality of life. All those things, we can't afford more of the same. So as a society, we need to understand how these cars are going to affect congestion. Cars are talking about autonomous vehicles are going to affect congestion, public transit, and the environment. And as practitioners, we need to ask ourselves, how can AVs mitigate or exacerbate transportation inequities around race and class that we face today? So that's the question that I wanted to answer. And in the next few slides, I'll talk about the project that I did at UCS, working with the DC Metropolitan Planning Organization or the Transportation Planning Board to look at kind of doing a use case analysis on how AVs could affect the area. So in our study design, we started with the travel demand model that is used by the National Capital Region Transportation Board, which I refer to as a TPB for short. As I mentioned, the TPB is the DC Area Metropolitan Planning Organization, which is responsible for developing long-range plans for the transportation system in the DC, Maryland, and Virginia metropolitan areas. With using their model, we created parameters that assumed the behavior of autonomous vehicles. So we had two scenarios as baselines. At the time I did the work, they had a long-range plan that was based off 2017 estimates, and then we also had in the long-range plan, it was based out to 2040. So we basically had the existing condition for 2017, and then our future baseline was going to be the conditions in 2040. We also looked at the impacts on job accessibility, specifically the number of jobs within a 45-minute commute by both transit and car, and congestion via congestion vehicle miles traveled metric. And then we looked at how these indicators would change when modeling a pooled ride scenario. As you see here, the single occupancy vehicles versus pool rides in a scenario where transit is invested in and compared to those 2017 and 2040 baseline scenarios. So when we talk about pooled rides, we mean that those that are shared among more than one passenger, which is similar to Lyft Line, Uber Pool, Waze Carpool, et cetera. And we also looked at how incorporating this desired long-range transit plans in the region, which was based in the 2040 plan at the time that was released, would affect the indicators mentioned. So first, I want to look at regional job access by car and transit within a 45-minute commute, which is the typical parameter that many NPOs use to see how the long-range plans are going to affect transportation within the area. They look at job access by commute, either by car or transit or other modes. So, in our scenario, one caveat I want to know is that in our scenario, when we talk about AVs, we assume that we're going to have 100% autonomous vehicle fleet. So basically, every car is replaced by autonomous vehicle fleet when we look at incorporating pooling and better transit. So I want to put that caveat in there so you can understand kind of where we're coming from. We see that the good news is that AVs can increase people mobility. This chart shows that in the base case scenario with both pooling and better transit, the number of jobs that people can access in a 45-minute commute by either car or transit doubles compared to the 2040 baseline. And while this metric focuses on jobs, We know that having just generally improved access also allows people increased access to education, shopping for healthy food, and other social and cultural opportunities that are usually cut off when people don't have that access to mobility. Note that when you have much smaller gains for pooling, you see that without pooling, 80% of the potential increased access is that we gain from pooling is lost because of congested roads, which undermines the potential benefits of AVs. This finding highlights how critical it is to introduce AVs together with policies that prioritize the movement of people over vehicles and encourage pooling. I also want you to note the impact of transit investments. So as you can see in the red lines, we see compare the number of jobs access by transit and car for pooled rides versus when we actually improve our transit system as well. With both pooling and better transit, the number of jobs accessible doubles for both transit and driving. But as you see, that without these investments, more jobs available will require a car trip. So as I mentioned earlier, the importance of a multimodal system when we're introducing AV is very key. So this shows that investing in our transit systems together with putting AVs on the road is very key, because that assures that people will have choices about how they can get around, and that could help to mitigate sprawl and other issues that come with that significantly increased car usage. And since transit is generally the most affordable option, this is most important, especially to people who are lower income or are from communities of color, which are the disproportionate users of transit. So as I mentioned in my talk earlier, inequality is a major concern in the area, with areas that have the highest amounts of communities of color more likely to live in poverty. So metropolitan organizations like the TPB are required to do an analysis on how their transportation plans will affect underserved populations. In their long-range plan, TPB identified areas known as equity emphasis areas, or EEAs for short. Now, the TPB defined EEAs as part of an environmental justice initiative to define which areas of the region face the greatest environmental risk. The organization TPB used census-level data to identify tracts that have significant concentrations of low-income and/or populations of color. So EEAs encompass a quarter of the region's households and residents that have a population density more than 3 times higher than the region as a whole. In terms of stats behind these EEAs, 43% of households within these EEAs have an annual income below $50,000, compared to 24% for the rest of the region, and 25% of households in EEAs have no access to a car, compared to just 10% for the rest of the region. So you can see there's significant difference in accessibility and income levels between EEAs and census tracts that are not EEAs. So in addition to the analysis that I did earlier, where we're comparing just jobs accessible by car and transit across the entire region, we also did comparisons between certain neighborhoods that were defined as EEAs compared to the neighborhoods that were defined as non-EEAs. And so we compared to similarly located neighborhoods. And we did 3 pairs. So if you're familiar with the DC area, Landover, which is based in Maryland, versus Bethesda, also in Maryland. Landover is an EEA and Bethesda is not. And we also looked at historic Anacostia versus Cleveland Park. Anacostia is the EEA and Cleveland Park is not. And then Dumfries, Virginia versus Damascus, Maryland. So for time purposes, we're just going to focus on Landover versus Bethesda in my analysis. And we did, well, we did very similar comparisons for the historic Anacostia versus Cleveland Park and Dumfries versus Damascus. So as you can see, I wanted to show kind of a comparison between Landover and Bethesda based on their income and percentage of color. So as you can see, Landover, Maryland which is highlighted in the pink star, has a median income of about $54,500, and it consists of 88% people of color. And Bethesda has $124,400 median income and is 19% people of color. Now they're both located in a similar area, Bethesda and Montgomery County, which, as you can see, is on the western side of Maryland, and Landover, which is about the eastern side of the region. So for Landover, which is, as I mentioned, the EEA, we see that when we look at the job accessibility by car from 2017 to 2040, we see that we get a significant decrease in job accessible by car. And that's, of course, this is basically what we call a as is, no change scenario. Basically, this accounts for the increase in population, of course, the increase, and therefore the increase in in number of cars in the area, and therefore you see significant increase in congestion, and therefore that leads to jobs being not as accessible within that community. But we see that compared to Bethesda, with areas similar population and has better access to transit compared to Landover, we see that the number of percentage change, at least from 2017 to 2040, is not as significant compared to Landover. Now, when we look at no pooling, which is the second here, we see that we actually get a slight increase in the job accessibility. Now, no pooling does include the increased and better transit. So that shows that, yes, even if we if we don't really change too much outside of improving our transit system, which is, of course, having, for example, having more metro as our transit system in the DC area. If we have longer cars, if we have longer train cars, if we have more trains coming through our system, aka smaller headways, we see that we still get a slightly increase in our job accessibility. But when we look at actual pooled rides, so instead of having single occupancy vehicle passenger rides, in addition to our improved transit access, if we have 2 or more passengers in our car, we see significant increases in both Landover and Bethesda. So again, this is just key to show that in an AV scenario, really pushing for pooled rides, shared rides, to mitigate the congestion that is going to come naturally from increasing populations in the area, but also from an increase in car usage due to the proliferation of AVs is very important to note. In addition, we see that investing in transit led to job accessibility by transit increasing almost 500% for people living in Landover. And this is important to note because, as I mentioned, Landover is 80% community, 80% people of color. They're more likely to take public transit as their means of movement. So it further supports the importance of transit investments in a self-driving car environment. So based on so again, this is kind of a snippet of the work that we did in 2017 to 2019. But we have the same recommendations for policymakers as they contemplate how to incorporate AVs to, again, improve equity. Right? So first is encourage pooling through incentives to optimize the movement of people rather than vehicles. So it's not just focusing on increasing AVs and then maintaining the single occupancy vehicle paradigm that has so defined our driving patterns in this country, but really encouraging shared rides, to encourage carpooling, or of course to encourage, and kind of a caveat, to encourage land use that encourages people to reduce their usage of their cars so they can get to the places that they need without having to use either transit or walking or biking. And I think that's even more so relevant in today's times with the pandemic. We also encourage the investments in complementing of public transit. As I mentioned, a multimodal system is very key for equitable transportation and inclusive transportation system. So while AVs can be a part of that future, they can't be the only solution because they're only going to provide, that direction is only going to bring more problems than we already have. So really thinking about how transit can be supported in addition to an AV future is very key. And with the increase in AVs, we encourage electrification of them as well to minimize and reduce the impact of emissions. I didn't show this slide in the sake of time, but we see that even with pooled AVs, we get a 50% increase in congested vehicle miles traveled. Of course, without pooling, that number jumps to 66%. So if we're going to see congestion, and that's a whole nother issue that's up for discussion when it comes to the proliferation of autonomous vehicles, we need to think about the significant climate impacts. And so we're encouraging electrification of these vehicles is very key, and along with pooling. So it's really good to see even today, since that time we did the report to today, we're seeing billions of dollars of investments from the Fords and the GMs and the other organizations to do this work and to electrify cars. And then lastly, really thinking about inclusiveness, that all communities will have a voice in shaping their own future. So that's having these communities be able to go to their social to meetings or transportation meetings, the NPO meetings, the local department meetings, and having accessibility to them. And of course, the pandemic has encouraged the usage of Zoom and other digital communication platforms where people who typically don't have access to meetings now do. So this is really important that we continue to see this push forward. So with that, I end my talk and I look forward to your questions and comments.
Thanks so much, Richard. So this now concludes the presentation portion of our session. So Kathy, Adam, I encourage you or invite you to turn your cameras back on. Great. Thank you all for sharing your unique perspectives on equity and AV. So as I mentioned, audience members can submit questions through the Q&A portion of the platform. Looks like we've got a few already. I'm going to start with one of our pre-prepared questions, and then we'll jump into those Q&A submitted questions. So the first question that we have, there have been many concerns raised about the affordability of these emerging technologies, particularly for low-income populations. And I know, Richard, you talked about this just a little bit, but from each of your perspectives, what are some of the concerns, what are your concerns on this issue, and what do you think are some ways we can help to address the issue of affordability? So let's have Richard go first, and then maybe Kathy and Adam.
Sure. Great. Yeah, that's a great question, Jennifer. Thank you for bringing that up. I think when it comes to affordability, there's a couple of things I think about. I think one is, as I mentioned earlier, the encourager sharing and providing kind of a system where people who people who don't have cars can still get around AVs and not need to own cars. So, there's this talk about, which I'm sure we're all familiar about, mobility as a service, right? So I don't have to own a car, but I can AV, but I can still be able to use the benefits of one by sharing with others. So, the Lyft lines, and Uber pools, and Zip cars, those kind of models, kind of where you can demand a ride when you need, whenever you want, and allow you to get to the place where you need to go, where you don't have to own that car, so you don't have to have that initial, large investment in purchasing the car. You can purchase the ride and go where you need to go when you need to go. So that's, I think, one way to look at, the affordable and making AVs more affordable. I also like the idea of, and we've talked about this in some of the work that I've done on the electric vehicle side. The tax credit is a big, of course, very polarizing discussion when it comes to electric vehicles, but having some sort of like incentives, and whether that might be if somebody's looking to purchase a car, having credits, not tax credits, but at the point of sale. So you actually see a decreased right when you purchase that car, could be one way to increase affordability in these vehicles.
Thanks so much for that input, Richard. Appreciate it. Kathy, do you have any additional thoughts on this question?
Yeah, thank you. Just a few thoughts. One being, there's so much happening right now in terms of transportation infrastructure across the country. And Adam talked, about what they're doing in Iowa, which is great. And I think, older adults, persons with disabilities who really need affordable transportation options need to be at the table when things are being planned and discussed, so that their needs are brought to the forefront. And those participants need to represent, broadly, their population groups across, different communities of color. So, one of the activities that's happening across the country right now is something called AgeFriendly Communities. And maybe some of you have heard about it. The age-friendly model was developed by the World Health Organization, and AARP has picked it up And they have been providing really great tools and resources for communities to embrace this approach. And I think there are now over 600 communities that are working on plans right now and moving forward. And I'm not sure to the extent to which AV has been embedded into some of those plans, but I think that's a really great way to bring it to the forefront and to talk about issues related to affordability and to talk about how AV kind of fits in, as Richard was talking about, with a broader multimodal transportation system. So, one other area we're looking at is, particularly for medical related transportation needs, how we can tap into healthcare payers plans. We're seeing some movement in that area with Medicaid, for example, state Medicaid allowing payment for transportation to various appointments, and also within Medicare. Medicare Advantage plans now have more flexibility in how they can address the broader needs of older adults, including transportation. So we've seen in Medicare Advantage partnerships between like Lyft and Uber, as well as community-based transportation. So that's one way, how we can tap into the healthcare dollars to support AV. So just a few thoughts there.
Yeah, thanks so much for sharing that, Kathy. Adam, do you have any final thoughts on this question?
Yeah. So, as a state agency, with budget shifting to preserve and operate the transportation system, funding to really expand to opportunities like this can be pretty limited. It's not cheap. And as a state, when we try to pursue efforts like this, we're typically looking for federal grants or other partnership opportunities. But those grants come at a cost too, whether it's staff time or having a consultant prepared. So, a lot of us have conversations about refocusing the conversation at the national level to figure out how we can, not necessarily ask for more federal money, but, repurpose the funding that's out there to support the deployment of emerging technologies. But, realistically, that has its challenges in and of itself. I was just on a call this morning with the American Association of State Highway Transportation Officials, or AASHTO, and, comments were made about the focus on EV infrastructure. And, then it's anticipated AVs and EVs will come together. But, there's been kind of a shift to maybe focus solely on the EVs and maybe less on the communication side of things to, communicate between vehicles and the infrastructure. But that's, not unexpected because deployment timelines are unknown. So, some of the states we're hearing from are saying, we don't want to put a lot of money into this yet. So still some opportunities to partner with the industry and figure out where things are going. But certainly things we're exploring as a state.
Thanks so much for sharing that perspective, Adam. Really appreciate it. All right, I'm going to move to the submitted Q&A questions. It looks like the question that has been upvoted the most is the one for Richard, which is, do the business models that today's AV developers are pursuing, are they able to meet the objectives that you outlined? And what incentive structures should be adjusted to ensure equitable access? So kind of a two-part question there. So Richard, I'll let you take it away, and then if others have thoughts, they can add in.
Sure. Yeah, great question. I would say I don't believe that. I think if you really look at the business model for many of these AV companies or those who are contributing to the general AV infrastructure, they talk about wanting to. Their main priority is they talk about wanting to reduce crashes, reduce car deaths from unfortunate instances on the road. But a lot of times, they're, as any company who's looking to, invest $1 billion into new technology, they're looking to get back some sort of, return from it. And I think history has shown in many instances that the focus on profit often does not prioritize equity, does not prioritize accessibility, does not prioritize affordability in that. And I would say that even I think it's the same for the AV industry, in my opinion. But I'll also say on that, and this I think aligns to the second question, is that especially now I think that there's been there's currently a greater understanding of how transportation affects our lives, especially for those who have limited access, and these companies are being pushed by people, by advocates, by super representatives to think about these issues more as a whole and not just put these cars on the road and make a bunch of money off them and not think about how congestion is going to impact and increase and emissions are going to increase and all that. So I think there's that awareness from the companies in that sense, and I think in order for them to get to this system and this paradigm that I kind of relate to in my presentation, there needs to be incentives for introducing these vehicles either at a lower price point using grant dollars, either from the federal government or local state governments or from philanthropic outfits to either to install like pilots or the pilots that could take people from where they are where to go, specifically in these lower income or in primarily communities of color. That's one option. I think also tying, this whole idea of AVs is also, I think, related to land use as a whole. And so thinking about how we design our transportation infrastructure over the next 20, 30 years to just really reduce long car drives and really focus on short drives or short trips. And he's looking at AVs as a way to do that. And again, for a particular interest and focus in these communities of concern, I think is also a way to at least start that discussion there. But I think in general, changing the paradigm is a very tough challenge because we haven't really seen that in our history. But I think you can, if you're able to really focus on these communities, have like a really focused targeted in these communities, and provide an option that they haven't had before, you and can kind of compare their interest and their goals and their improvement in quality of life to company bottom line, kind of like what we call that triple bottom line, people, profits, and planet. Then I think you're able to see some of these goals that I've mentioned in my presentation come to fruition. I think it's going to be a slog. It's going to take time. It's going to take changing a lot of people's ideas and insights and how they look at transportation and just how companies operate in general, but it can be done if the will is there.
Thanks so much for sharing those perspectives, Richard. Really appreciate it. So along those lines of how we need to be thinking differently this time around to actually address those issues, Kathy and Adam, do you have any additional thoughts along that line of questioning?
I do not.
No, I think Richard covered it, and I think part of my response previously relates to making sure we've got the right people at the table to identify the issues that need to be addressed from the get-go as we move forward.
Thank you so much. Another question that was submitted that has been voted up quite a few times is directed for Kathy. So what AV pilots can you point to that are directly aimed at serving senior citizens? I know you mentioned the Aging Well Communities, but do you know of any AV pilots that are directed that way? And what other approaches would you like to be seeing in states like Pennsylvania?
Yeah, that's a great question. I'm aware of some pilots, around grocery store delivery using AV. I think Walmart did one with an AV company called Cruise. I've also heard of some pilots that senior living communities are doing to transport their residents, like to common locations, for example, shopping or museums, entertainment venues, those types of things. I learned about those last year. I'm not sure where things stand right now, but I think that is certainly a great way in which AV can be used. And, for senior living, particularly senior living communities, independent living, where older adults can come on and off, or if they have accessible AV vans, those who use wheelchairs and walkers, that would be great. I would love to see AV used in places like senior centers too. Many senior centers don't have their own shuttles, but if they could partner with some companies and do some pilots to get people to senior centers, I think would be really great. I mean, another way I could see AV being used too is around volunteers. So there's a movement called the Neighborhood Village Movement. It started in Boston and Beacon Hill, and it really is neighbors helping neighbors. And the number one need among those who are part of these villages is no surprise, is transportation. And there are, certainly many people who want to volunteer, but maybe don't have their own vehicles, or they can't volunteer during the week when, for example, medical appointments take place. So using AV to leverage volunteers, I think it is really important. Also, even looking at the use of AV to bring home health aides or personal care aides into the homes of older adults and persons with disabilities. Many of those workers are low income themselves and don't have transportation. So this would be a great use of AV as well. So just, again, some thoughts on ways in which AV could be leveraged, again, if it is affordable.
Thanks so much for sharing that, Kathy. Those are some really great ideas. Absolutely agree. So we are right at just past the end of our session. So I'm going to say thank you to all of the speakers, Richard, Kathy, and Adam, for sharing your perspectives and for engaging in this thoughtful discussion. To the audience, we will now be exiting our presentation mode and go back to the conference room mode, where you will be able to chat with other attendees for the remaining time until the next session starts. When you're ready to move out of this breakout session and go on to the next, just go up to the top left of your screen and open up the drop down to select the session you would like to attend. The next sessions available for today are the workforce training breakout and the incident management breakout. So when you're ready, please choose either of those sessions to attend, and we'll keep the conversation going. So thank you once again to our speakers, and thank you, audience, for taking the time today to join us. Everyone have a great day.